We are so excited about this new Cochlear Children's Implant Center mobile unit. It's going to impact so many children across the state.
We are going to go on the road so we can help more kids across North Carolina access hearing care. Kids who are deaf and hard of hearing, kids who have suspected hearing loss. We can do diagnostics. We can do programming of cochlear implants, hearing aids, speech and language services, all closer to our families' homes. Patients drive 4 or 5 hours even to come see us, so it's a big burden on those families. And we also wonder how many kids just never make it to us.
We're going to be able to test children all over the state so that people who have trouble traveling and coming to centers of excellence, which there really aren't many in North Carolina, to treat and diagnose these children. So now we're going to be able to go out to where they live, and our hope is that we're going to catch all children who fail their newborn hearing screens so that they can get early intervention, which means they'll have better communication, better connection with their family, and just a better future. So that's what we're really all about.
Nowadays, if a child who is born deaf or hard of hearing and needs a cochlear implant, if they are implanted young enough, typically they have age-appropriate spoken language, so they are communicating just like any other child by the time they reach preschool age. It's amazing. Cochlear implants are the coolest technology I think that's out there.
I'm so incredibly proud of our entire CCIT team, led by Dr. Yarborough, our amazing medical staff, audiologists, speech-language pathologists, really just to have the vision to create this amazing service and deliver it statewide. So with that, we've got to get the wheels rolling and get this bus on the road.